Hi everyone, my name is Sofia Anissa. My matrix number is 0695N1. So today I'm going to talk about ankylosing spondylitis. First of all, you can know the meaning of this disease by looking at the name. Ankylosing is stiffening, spondylo is vertebrae, and itis is inflammation. In addition, this disease is also known as Pachyry disease, and it is related to HLA-B27 gene. It is also a chronic inflammatory disease that affects vertebral joints and will cause severe pain to the people who are affected. Moving on to the pathophysiology of ankylosing spondylitis. Firstly, ankylosing spondylitis happens when the immune system mistakenly attacks the healthy tissues. This will make the cytokines signaling other immune cells like neutrophils and release tumor necrosis factor alpha and will make the inflammation worse. The inflammation will destroy the intravertebral joint, the facet joint, or the sacroiliac joint of the vertebrae. After that, the fibroblast will replace the destroyed joint with fibrin. Due to repetitive damage and replacement of the fibrin, it will produce a fibrous band around the joint and will make the range of motion of the person limited. Then, the osteoblast will be activated and make the fibrous tissues turns to bone. And this process is called the ossification. This process will start by produce of the bony outgrowth at the joint edges, and this is called the syndesmophore. Moving on to the causes. The causes of this disease remain unknown, but it may be caused from genetic factors. As I said before, HLA-B27 gene or human leukocyte antigen B27 are related to this disease. These are all the clinical features of ankylosing spondylitis patients. First, they will have fusion of vertebrae. Second, they will have limited mobility and stiffness because of the fusion. Third, they may have neck, back, or buttock pain due to the affected area. After that, they will also unable to sit and stand correctly due to deformity. Lastly, this patient will have shortness of breath and feels fatigue easily. This is because the vertebrae is connected to the ribs, so the expansion of the chest will be reduced. After that, this is some points that we can see from the patient itself. The first one, the spine will curve forward or having kyphosis due to the fusion of the bones. Next, the posture of the patient's body will be stooped over, and lastly, the CBVA or chin brow to vertical angle will be more than or equals to 30 degrees, which is abnormal. Moving on to the investigations. The first investigations are X-ray and CT scan. In these two, we would see bamboo spine or hollow appearance simultaneously. Eventually, if the findings of AS in X-ray or CT scan is absent, the doctor will proceed with MRI scan. In this scan, we can see a narrowing of the joint spaces. Lastly, lab tests also can be done to check whether the HLA-B27 gene is in the blood or not. For ankylosing spondylitis, doctor will manage to do conservative and surgery treatment for this patient. For conservative, the first one is braces. This will help to produce support to the affected area. Second is the non-steroidal anti-inflammatory drugs such as ibuprofen to help to reduce the pain. And lastly is the muscle relaxant drugs. Second is surgery. It is a rare case due to prevent further complications, but it will be done if there is any nerve impingement and to reduce severe limitation of mobility. Moving on to the physical examination. The first test is the Scobus test. It will help to assess lumbar spine mobility. Next is the chest expansion test. We will use a measuring tape placing at 3 peaks. The first one is the manubriosternal junction. Second one is the xiphisternal junction. And the third one is the 10 rib junction. Then we will take the measurement during inspiration and expiration of this patient. The third one is the tragus wall test that will help us to measure the cervical mobility. And lastly is the gainless test.
To perform the test, Ask the patient to stand with their feet pelvic width apart. Mark the location of the PSISs. Now mark the center point between the two, and then measure and mark 2 inches below the center point and 4 inches above it. This gives you a distance of 6 inches between the upper and lower points. Now ask the patient to attempt to touch their toes while keeping their knees extended. Again, measure the distance between the upper and lower points. Normally, with lumbar flexion, the distance should have increased by 2 inches or more. If it measures less, it indicates a loss of lumbar flexion. To perform the test, ask the patient to stand with their heels, buttocks, and thoracic spine placed against the wall. Now ask the patient to keep their head in the neutral position and attempt to bring their head backwards to touch the wall. Normally, the skull should reach the wall. If the patient is unable to reach the wall, it indicates a cervical flexion deformity. Measure and record the distance between the tragus of the ear and the wall. Patient in the supine position with the side to be assessed close to the edge of the examination table. Ask the patient to lower the limb to hang free from the table and then grasp the opposite knee and draw it to the chest. Place a hand on each limb and apply pressure to increase extension and flexion of the hips. This test is considered positive if the patient experiences pain in the posterior pelvis in the area of the sacroiliac joint on the hyperextended side.
Next is the physiotherapy management. The first one is the stretching exercise that will help to increase flexibility. Second is the posture correction. This will help to maintain neutral spine posture by using ergonomic advice. For example, use a chair that is well supported. The third one is the strengthening exercise. This will help to preserve the available range of motion and also improve endurance. The fourth one is the breathing exercise. We can teach the patient to do diaphragmatic breathing exercise as it helps to increase lung capacity. Next is hot and cold therapy. For example, we can apply hot pack before doing exercise to improve joint mobility. And cold pack can be applied after the exercise to reduce pain. Lastly, we can also do aerobic exercise. It will help to increase cardiovascular fitness and also releasing of the endorphin, which is the natural body painkiller. In addition, aerobic exercise is also not too heavy for the patient to do it every day. Thus, this is all the management aims for the patient. After making sure the patient is followed our exercise given, all these aims like reducing pain, reduce morning stiffness, reduce work of breathing can be achieved.